Hi, Dr. G here. Thanks for watching this short video. So today's video is about spinal traction, more specifically lumbar traction. So lumbar traction means traction of the low back area. What is lumbar traction? Lumbar traction is a non-invasive treatment where you're being stretched in the low back area, and what that does is that it increases the space in between the vertebrae and it decompresses the low back area. It takes pressure off the low back and the discs. So this is beneficial for people that have degenerative disc disease, disc herniations, foraminal stenosis, and even facet syndrome. Now, certain people shouldn't do this. People that have spinal tumors, osteoporosis, or people that have had a spinal fusion. So in this video, what I'm going to do is I'm going to talk to you about 3 different pieces of equipment that I've used that practice the same treatment, that do the lumbar traction. First piece of equipment is this decompression table. Now, this is a table that you have to actually go to a doctor's office to get treatment. So what they do is they have a table that is connected to a computer. They strap you down on the table. They lay you down either on your back or on your stomach. And then you have a belt that goes around the torso and one that goes around the waist. And this table is connected to the computer, so the computer is programmed to pull your spine at a certain amount of force, and that's controlled by the doctor. And the pros about this is that you are in a controlled setting. You're with a doctor there who is supervising you, so everything should go okay. Now, the cons to this type of treatment is that you have to go to the doctor's office, so over time, it can cost a lot of money. And this is what the equipment looks like. So this is what a disc decompression therapy bed looks like. We have the bed over here, and we have straps over here, and this is what we strap the person down with. One goes in the upper back area, in the torso, across the chest, and then we have one that goes over here in the pelvis area, and it's connected to this computer over here, and that's where we program everything, the pounds of pull and what kind of traction we're doing, whether we're doing lumbar traction or cervical traction. And the cool thing about this bed is that once we strap the person down, the bed over here is going to be pulled by the computer, and as you can see over here, if I pull, the bed slides to the side, so that's where the traction comes from that movable bed. Now, the second piece of equipment is an inversion table, and an inversion table looks just like a stretcher, and on the bottom it has some pieces of equipment that allow you to anchor your feet down. And the whole purpose behind inversion is to use gravity to your advantage. You're using your upper body weight plus gravity to decompress the low back area. So you're going to start in this position with your head on the top, your feet on the bottom, and then slowly start to invert so that gravity pulls you down and decompresses the spine. Now, the pros about this type of treatment, inversion table, is that you can do it at home. It's also very inexpensive. For anywhere between $100 and $300, you can buy an inversion table, take it home with you. You pay only once, and then you continue to use it over and over again. Now, the cons for this treatment is that not everybody can do it. People that have ankle problems and knee problems will probably hurt more if they're hanging from their feet. Also, since you're having blood rushing to your head, people that have certain health conditions such as high blood pressure, heart problems, inner ear problems, cardiac problems shouldn't do that. Also, people with glaucoma, since they already have higher blood pressure than normal in the eye. So you're having this blood rushing to your head, so those people shouldn't do that. Now, you don't have to completely invert upside down like this in order to reap the benefits of this. As little as 45 degrees will have your spine decompressing, and that can bring a lot of relief for people with low back problems. And this is what an inversion table looks like. All right, so here we are. This is an inversion table. So you can see right here. Right here is what you would strap your feet. Your head goes over here, and this will invert with your head being hanging upside down. You don't actually have to be completely inverted, but any type of inversion will do very good for the low back. Now, the third option is a decompression vest. Now, this is a vest that you can hang from a pull-up bar. You strap it around your rib cage, and then you basically let gravity do the work. You're going to be doing almost the opposite of the inversion table here. You're going to be using your lower body's weight and gravity to decompress the spine. Let the spine just relax and get stretched out. And this is very inexpensive. The pros about this is that it's very cheap. You can get one for about 60 bucks. Of course, you have to have a pull-up bar, so you might have to get that as well. Now, the cons for this is that Women may not be too comfortable with this because you're strapping the belt around your rib cage. Your breast may interfere. And this is what that looks like.
So here's how a decompression vest works. You first attach it to a pull-up bar, then you're going to Velcro the vest around your rib cage, and it also comes with 2 additional belts for additional support. As you can see here, I get the first belt around my rib cage, and this will be the second belt going around my rib cage. And now what I'm going to do is I'm just going to hang on to 2 straps that it comes with, and now I'm slowly just letting my lower body weight drop. What this is doing is using gravity and the weight of my lower body to stretch the lower back, to decompress the lower back area. And once I'm done, I just stand up and I just do the opposite to take it off.
So there you have it. That's my take on those 3 pieces of equipment that can be helpful if you're suffering from lower back pain. As I said earlier, those are good for people with disc herniations, degenerative disc disease, foraminal stenosis, facet syndrome, and sciatica. What I'm going to do is I'm going to leave a link to those products down below here for you to look up more information about them. In the meantime, if you like the information on this video, make sure you give it a thumbs up. Also, make sure you subscribe to my channel so you never miss any new videos. And if you're looking for ways to treat sciatica and low back pain without back surgery, painful injections, or addicting painkillers, make sure you visit my website, painfreeinstitute.net. Thanks for watching and have a great day.